Dr. J. Baruch began his career in medicine as an English major. For a writing exercise, he visited a hospital to speak with patients, learning about them and hearing their stories, who they were and what they were suffering from. It was after that day that Baruch decided he wanted to be someone who could positively impact those people's lives. So he switched from English to medicine and eventually ended up becoming an emergency room doctor.
Like anything, we rationalize all our decisions about what we're going to do with our lives, but ultimately something just feels right. Like you feel comfortable in the space. And I was both intimidated by just the craziness and the immense responsibility and just the controlled chaos of the space. But at the same time, I felt very much at home. And I can't rectify that. And I've been trying to rectify that for the last 30 years.
Baruch is an emergency physician as well as a professor of emergency medicine at the Warren Alpert Medical School at Brown University. He says the raw nature of the ER is what initially drew him in.
The fact that you'll see anyone and anything at any time, and to be able to care for people who can't get care elsewhere. Part of it was the exposure to so many different types of people and the stories that they were bringing.
Stories that inspired Baruch to write his most recent book, Tornado of Life, A Doctor's Journey Through Constraints and Creativity in the ER. With nearly 30 years of experience in the ER, Baruch offers an inside view of some of healthcare's most pressing problems.
We're the canary in the coal mine. Like, we knew there was an opioid problem years and years ago before it became like the opioid problem. We have experienced the great mental health challenges that many of our communities face and the lack of insufficient mental health services for these patients. For decades, we've been writing about that and calling for that and advocating for that and knocking on doors for our legislatures and our government officials to make some changes about this.
Unfortunately, Baruch says these and other challenges have only increased throughout his career.
The disconnect between the haves and the have-nots and the inequities of healthcare, and the fact that so many of us are a couple of bad breaks from being on the short end of things. We really are. I mean, that's what you witness. We're seeing all that. They come to the emergency department.
One particularly difficult period was during the pandemic.
A lot of hospitals across the country, lost a lot of staff. There was people, a lot of nurses became travelers, and some people left the field. And, the pandemic itself took a significant mental health toll, I think, on many, many healthcare providers of all types. And because of various crowding issues, like we did, especially when we saw during COVID, that impacted so many hospitals across the country, there's an improvisational element, right? You end up, sometimes you don't have enough beds, or there's patients who should be upstairs but are down in the emergency department. And so you have to start seeing people in unusual spaces. So you're trying to identify who might be waiting, who might be sick, who needs the attention, who you should lay eyes on sooner rather than later.
And many hospitals are still trying to get back to normal.
During those 2 years, a lot of people couldn't get the care that they needed. Tests were put off. People lost jobs, lost health insurance. People really sort of not unmoored by that. And so we are getting back to normal in a certain way. Our space is still the same. However, I think the complexity of patient problems that we're seeing, it feels to me, we talk about it amongst ourselves, like the simple, straightforward patient doesn't seem to exist as much as it used to be. And some of that is due to all the challenges and health challenges from COVID.
With all of these issues piling up, Baruch says many emergency rooms are barely scraping by, meaning he's having to juggle all different types of tasks at once.
So you have to hopefully spend time with patients, and you have to make time to examine patients and talk to them and call them on the phone, if depending on what your practice is, or talk to a family, talk with your colleagues and consult about cases and coordinate care. Check lab results, if you're an outpatient provider, and check, diagnostic imaging results. And you have to document all your patients that you see. And then you have the bureaucratic stuff with health insurance companies.
Baruch says the tone shifts not only day to day, but even in the span of mere minutes.
You end up going from a terrible code or something that's really awful happened to someone, and then you might have someone who is waiting with an ankle sprain, and they're upset that they waited so long, and you're trying to both be compassionate and understanding, while deep inside you're like, I just coded somebody and told a family that their loved one is dead.
And as much as Baruch tries to see both sides of a situation, this emotional whiplash can be confusing. During the pandemic, he found himself putting up an emotional wall between him and his patients. Over time, Baruch realized he'd just traded one extreme for another.
Was it worse to have the shell and feel nothing, or to sort of have this porous skin and have my nerves alert and alive and feel everything? Because both seemed like a less than ideal situation to be in.
Baruch has started to find a balance between the two, but still catches himself sometimes becoming closed off. While he can see anywhere from 20 to 30 patients during an 8-hour shift, Baruch says even just 15 people can be overwhelming. Part of his job means listening to the experiences of each patient, which are often stories of trauma. And even though it's necessary, Baruch says the chaotic, open environment of the ER is often counterintuitive to this process.
Some of our greatest satirists, things like Kurt Vonnegut, I don't think even he could invent a place that was so dependent on getting a story right. And yet the space is so does everything possible to make getting patient stories and communicating hard. I mean, it's like you're seeing multiple patients simultaneously. Oftentimes there's a lack of privacy. We have strangers telling stories to strangers. Most of my patients don't know me, nor do I know them. There's trust issues, like how much can they trust me or the nurses and the staff caring for them with embarrassing, anxiety-provoking, fearful information.
And communication isn't the only hurdle that comes from this hectic ER environment. Baruch says it can also be difficult to feel completely confident with his diagnoses or treatment plans when working in such a fast-paced setting. But throughout his career, Baruch's realized that there's one feeling he should be embracing instead of ignoring, which is uncertainty.
The medicine looks at uncertainty as something to be remedied. The antidote to uncertainty is certainty. And the response to uncertainty is usually to order more tests and to do more diagnostic imaging. And there are various consequences as a result of that. And the truth of the matter is that oftentimes we do all these things and we still never get to a point where we have to interpret information, right? We don't always get more certainty. We might get a few more answers, but we might not get certainty.
But what if doctors view this as a tool instead of an obstacle?
How do I use uncertainty, as I say in the book, as quoting the poet Mark Doty, as an ally? That we can say, listen, I'm going to use uncertainty not as a marker of being wrong, which is oftentimes, in medicine, it's like, you don't know, and it has a negative connotation. What if we use those moments of uncertainty to say, hey, listen, how did I get to this situation? What are some of the questions I haven't asked? How should I be thinking differently about it?
Which isn't to say physicians should be uninformed. Doctors need to be able to diagnose and treat various illnesses. But Baruch says there's a difference between ignorance and uncertainty.
I have to be right when I need to be right. However, there are some times when the situations are less clear, and to be comfortable in that space, and more than that, to be able to use that feeling to perhaps change the angles and to find out what the patient might be looking for and how to address those needs.
Which again involves a communication aspect that's difficult in this setting. And while some of the other constraints are more obvious, like not having enough time with patients, Baruch says the less obvious challenges are just as important. Many doctors face various internal struggles when treating patients.
Our ability to be compassionate and empathic, I find, is something that has been a real roller coaster journey for me. In the beginning of the pandemic, I was emboldened and inspired while also being scared. And then people coming in so sick and then dealing with the system issues, and a lot of the pressures end up just coming down on the emergency department. And I know it impacted a lot of us. And I know it impacted me. And, I was in some pretty dark places.
But what can lessen the burden? Baruch believes physicians should be focused solely on the patient instead of also having to deal with administrative tasks. For example, electronic medical records may appear to make his job easier, but Baruch says they've made his patient interactions much more complicated.
It was supposed to reduce paperwork, and I've never seen as much paper generated from printing out a chart generated from an electronic medical record. If I get patients transferred to us, like from other hospitals, which happens all the time because we're a tertiary care center, the chart will be 50 pages. 50 to 60 pages, and to find like the little nuggets of valid information, like was the CAT scan done on the head? Was the CAT scan done on the neck? What was that result? You can't find, like you're sitting there. It's almost easier if we just saw the patient at first, like they just came in.
But even if these lengthy medical records get sorted out, Baruch says this is just one part of a larger problem. He believes we need to go back to the basics and first decide what's the core of healthcare.
It's healthcare providers and patients. How do we meet both their needs and build up from there? Then, of course, there are financial issues and funding issues, but there's a lot of people in the middle. There's a lot of other businesses that have become quite profitable around the business of healthcare, and a lot of books that very honestly talk about patients as commodities, have become commodities for shareholders of other companies. And we have to get our moral center back.
Which Baruch says should be having the main focus of physicians on successfully treating patients.
Can we be perfect? No. I mean, can we be better than what we're doing with the time that we have available? Yes, I believe so. Absolutely. And I think it's our responsibility to have as many tools in our tool belt to try to understand and respond to the stories that patients are telling us.
Which is part of what inspired Baruch to ultimately write his book. It brings humanity back into the ER, showing how patients are more than just another problem to be solved. Tornado of Life is available now anywhere books are sold. You can find more information about Dr. J. Baruch and all of our guests on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. I'm Reed Pence. Coming up next week on Radio Health Journal.
Everything that I had tried hadn't worked. And when you have so many doctors blow you off, you're kind of like, well, maybe it is me. Like, maybe I am making it up.
A condition that experts say is severely underdiagnosed.
Then why we need to have more discussions around male infertility.
In men who have infertility and a male factor to the couple's fertility, those men are at increased risk for major health problems or even early death.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Keeping it clean, keeping it simple, just the facts. What is it that a smart professional would need to know about what's happening in the world today?
We've heard of snackable social media content. What about snackable journalism? Then,
kids are curious, so it's just natural inclination to just, let me just Google this word I heard that I don't even know what it means, or something silly with my friend.
The tips your kids should know when getting a cell phone. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.